Welcome to our SCI Educational Series number 12 on enhancing patient safety, focusing on effectiveness of manual cough assist in our SCI patients. Patients with spinal cord injuries, especially those with lesions at or above the C5 level, experience impaired respiratory muscle function, making it difficult to clear secretions through coughing. This impairment significantly increases their risk for respiratory complications, including pneumonia, which remains a leading cause of morbidity in SCI populations. Recognizing this vulnerability is essential for ensuring timely intervention. Manual cough assist is a non-invasive, cost-effective intervention that mimics a natural cough to facilitate mucus clearance. This technique can be performed bedside, often requiring minimal equipment but significant skill and awareness. My name is Michael J. Orellano, your SCI nurse educator. As SCI nursing staff, being the first line of care means having the responsibility to recognize the signs of respiratory distress and apply this intervention efficiently. The purpose of today's training is to reinforce why manual cough assist is critical, demonstrate how to apply it safely, and empower staff to incorporate it into daily care. This is not only a skill but a responsibility. Early action can prevent emergency escalation, improve respiratory outcomes, and ultimately save lives. The objectives of this session are designed to enhance knowledge and readiness for managing respiratory challenges in SCI patients. First, understanding the role of manual cough assist is vital. It is more than a clinical technique. It is an essential component of maintaining pulmonary health and preventing complications in patients who cannot effectively cough. Second, being able to identify when a cough is ineffective, through signs like weak chest movement, audible mucus, or rapid shallow breathing, is critical for early detection and timely intervention. Nurses must be vigilant observers and act promptly when such symptoms arise. Lastly, this training prepares staff to confidently perform the cough assist maneuver in emergency settings. Knowing how to position the patient, time the thrust with exhalation, and monitor for response ensures both safety and effectiveness. All three learning objectives are interconnected. Knowledge informs practice, assessment triggers intervention, and skill ensures successful management. Mastering these aspects will significantly reduce avoidable respiratory complications in SCI patients and support our commitment to veteran-centered, safe, and evidence-based care. Assessing for ineffective cough is a critical component of respiratory care for SCI patients. A weak or absent cough, audible congestion, or visible shortness of breath may indicate mucus retention and impaired clearance. These signs are subtle yet urgent, and SCI nursing staff are ideally positioned to detect them early during routine care. Observing chest movement and assessing peak cough flow using portable devices at the bedside can help quantify respiratory strength. Documentation of trends over time further supports clinical decision-making. Collaboration with respiratory therapists enhances assessment accuracy and enables comprehensive care. These professionals provide advanced pulmonary evaluations, but their effectiveness depends on nursing staff who initiate timely consults. Early identification and response prevent the development of pneumonia and reduce the risk of emergency interventions like intubation. By consistently assessing for these indicators and maintaining open communication with the interdisciplinary team, nurses uphold a proactive approach to patient safety and respiratory stability in spinal cord injury care. Prevention remains the most effective strategy for maintaining pulmonary health in SCI patients. Incorporating manual cough assist into routine care, specifically during morning and evening hygiene routines, ensures consistent mucus clearance and reduces secretion buildup. This habit also reinforces the importance of airway hygiene as a part of daily living. Educating veterans and their caregivers about the necessity of daily cough assist empowers them to take an active role in managing their condition, leading to better compliance and improved outcomes. Proper technique training fosters autonomy and reinforces continuity of care at home. Additionally, maintaining the patient in an upright position during and after meals, and ensuring adequate hydration, enhances mucociliary clearance and prevents thick secretions from accumulating in the lungs. These simple but effective interventions, when routinely applied, serve as powerful tools to prevent pulmonary infections, hospital readmissions, and acute respiratory distress episodes. Nurses play a central role in reinforcing these preventive behaviors and in supporting both the veteran and caregiver in understanding the importance of daily respiratory care. Effective execution of the manual cough assist technique starts with correct patient positioning. Sitting the patient upright maximizes lung expansion and airway alignment, which facilitates the mobilization and expulsion of mucus. The key to a successful cough assist is synchronizing the abdominal thrust with the patient's exhalation. This simulates the natural force of a strong cough. The thrust should be quick and firm, but not forceful enough to cause discomfort. Repeating this maneuver 3 to 5 times with adequate rest intervals enhances mucus clearance while avoiding fatigue. During the procedure, continuous monitoring is essential. Observe for signs of fatigue, declining oxygen saturation, or increased respiratory distress. These could indicate the need to pause, adjust technique, or seek further respiratory support. Communication with the patient throughout the process helps maintain comfort and trust. Teaching and reinforcing this technique during staff training boosts confidence, ensures standardization, and empowers nurses to act swiftly and effectively when respiratory support is urgently needed. Respiratory emergencies in SCI patients can escalate rapidly due to their inability to generate an effective cough during distress. A mucus plug blocking the airway can reduce oxygenation within minutes. Nurses must recognize this as a true emergency, similar in urgency to cardiac arrest. The inability to clear the airway increases the risk of hypoxia and respiratory arrest. Manual cough assist provides immediate non-invasive intervention. When performed correctly and swiftly, it can relieve obstruction and restore airway patency. Timely action often eliminates the need for intubation or prevents a full code event. It is crucial that all nursing staff feel confident and competent in responding with this technique during emergencies. Simulation-based training and regular practice sessions can strengthen readiness. Rapid, decisive action grounded in knowledge and skill transforms nursing response from reactive to life-saving. This reinforces the commitment to veteran safety and enhances the trust veterans place in their caregivers during high stress. Cough assist mastery enhances the overall clinical readiness of the SCI nursing team. When all members are trained and practiced in emergency respiratory response, care delivery becomes more efficient and cohesive. This level of preparedness reduces hesitation during real-time events, allowing faster interventions that save lives. Beyond the technical skill, this practice deepens the staff-patient relationship. Performing cough assist during vulnerable moments, when a patient feels frightened or distressed, requires not only skill but also compassion. Clear communication and reassuring presence improve the patient's emotional and physical comfort. This nurtures trust and creates a therapeutic environment. Furthermore, manual cough assist is aligned with evidence-based practice standards. Its routine use as part of care planning supports patient-centered outcomes and represents nursing excellence. Adopting and consistently applying this intervention demonstrates a commitment to safe, current, and competent clinical practice across the SCI unit. Manual cough assist is a vital and life-sustaining intervention in SCI care. It prevents severe complications by clearing airways before conditions deteriorate into emergencies. SCI nurses hold a pivotal role in this continuum of care, detecting signs of ineffective cough, performing timely intervention, and preventing adverse outcomes. Early detection of respiratory compromise paired with immediate cough assist can mean the difference between stability and escalation to critical care. Moreover, when this skill is practiced regularly and incorporated into routine workflows, staff confidence increases and patient outcomes improve, creating a culture of preparedness, supported by education and peer reinforcement, leads to a safer care environment for all veterans. SCI nursing staff, by mastering and consistently applying manual cough assist, reinforce their dedication to excellence, safety, and compassionate care. These principles align with the mission of the VA and elevate the quality of life for individuals living with spinal cord injury. This presentation focuses on the importance of cough assist technology in managing spinal cord injury. Effective respiratory management is critical in SCI to mitigate respiratory complications. The reference studies are important as they provide a comprehensive view of the global recognition of respiratory health in SCI care, emphasizing the need for addressing acute respiratory issues and providing immediate care for respiratory emergencies. Evidence-based guidelines support the use of cough assist technology, highlighting the role of airway clearance strategies and pneumonia prevention as vital components of comprehensive respiratory management. Collectively, these sources advocate for the integration of cough assist technology to enhance patient outcomes in SCI care, showcasing broad clinical support and empirical evidence from various perspectives. Thank you for dedicating time to strengthen this essential clinical skill. Respiratory safety is a critical domain in SCI nursing, and your commitment to mastering manual cough assist speaks volumes about your dedication to patient-centered care. These skills, when performed proficiently, can transform outcomes in both daily and emergency scenarios. Remember that every successful intervention you perform contributes to the strength and reliability of the SCI team. Clinical excellence is not just about knowledge, it's about the care, courage, and consistency that nurses bring to every interaction. Veterans depend on this expertise, especially when they are most vulnerable. Continue to seek opportunities for skill development, practice often, and support one another as a team. Together, we can ensure our unit remains a model for safe, responsive, and compassionate care. Your contributions are deeply valued, and your role as an SCI nurse is vital in every sense. Again, thank you very much.